We'll move on to our next presentation, which is from Alice Hendy, who is the Chief Executive and founder of the Ripple Suicide Prevention Tool, which we have had, which has been mentioned in previous learning sets. So very pleased today to be able to welcome Alice to share more about your story and the Ripple Suicide Prevention Tool. So are you okay to share your slides, I believe, Alice?
Yep, absolutely.
Brilliant, thank you.
Hopefully I could just check you can see those okay?
Yes, if you're able to put them on slideshow, that would be brilliant, so we can see them a bit larger. That's it.
Perfect. Thank you very much indeed. Good afternoon, everyone. Thank you for having me today. As mentioned, my name is Alice. I'm the founder of a piece of technology and a charity called Ripple. And I'm going to share with you a little bit today around my story, how it's come about, and most importantly, really, how you can support and get Ripple out to as many people as possible. So in terms of the background around why I've created Ripple, I'm not a mental health professional. My skill set and what I do for a living is IT and cybersecurity. But on the 25th of November last year, my life changed forever because I lost my brother, Josh, to suicide. He was 21 years old and my only sibling. And I received a knock on the door from the police officers to tell me that they had found Josh. After that initial point, I really became quite obsessed with looking for answers. Why did he feel like that was his only way out? What was going on in his mind that made him want to do this? And I went through his phone and his laptop, and what I found on there horrified me. Not only did I see that Josh had been searching for ways and means on the internet to take his own life, but he was also provided with tips and encouragement to do so. And it was Christmas Day of last year that I was sat with my parents in their living room, and I decided that I wanted to make a change and create a piece of tech which could not only intercept anybody who might be conducting searches like my brother, but to signpost them and redirect them to get mental health support that they need. And really it was there that Ripple was born. Why is this important? Searches for suicide methods have increased by 50% in the last 2 years. Searches for suicidal thoughts have increased by 23% in the last 2 years. And searches for suicide hotlines or helpline numbers have increased by 125% since January 2019. That to me says that people don't know where they can go to get support. My tool tells that person exactly where they can go to get that support at a time when they are most vulnerable and searching for this material online. What can I provide? There's a gap in the landscape here. There has been, and there is, many fantastic charities and organisations who do some wonderful work in reducing the stigma around mental health and indeed suicide in particular. But never has there been a practical piece of technology that can actually make a tangible difference. And this is it. I'm on all social media platforms, including LinkedIn, Instagram, Facebook, Twitter. I'm trying to resonate with a younger audience, but this is absolutely for everybody. The tool itself, and I will provide you with a demo shortly, will resonate with anybody because it has a range of different resources on there. It's not directed towards one particular demographic. With Ripple, I can provide analytics and data in terms of how many times the tool itself has been downloaded and how many times the tool has been triggered, i.e. the number of times a harmful search has been conducted. I can also track and monitor the number of times that somebody has interacted with the Ripple tool, i.e. they've conducted a harmful search, they've been intercepted by the tool, and they have then engaged with it and clicked on one of the support options that feature on the tool. What I can't do is actually provide names or locations of somebody who has conducted a harmful search. As much as I would love to, believe me, I'm just not allowed to do so. And as you would expect with somebody who works in cybersecurity and data privacy for a living, I'm very much all over that aspect around GDPR compliance and privacy and so on. My messaging is focused and consistent. I mentioned to you at the beginning, I'm not a mental health professional. My skill set lies within technology and cybersecurity. So to help me build my tool and gain the right guidance when it comes to wording and phrases and so on, I've worked extensively with mental health professionals, clinicians, lived experience panels, and over 80 mental health charities across the UK and also globally. They guide me on what I need to be doing, and Ripple wouldn't have come to fruition without the help and support of those individuals. Who is Ripple aimed towards? I think here really the question is more around who wouldn't have Ripple? This is a tool that is free for parents, individuals, schools, colleges, universities, libraries, charities to download now. From a business or corporate perspective, I ask them for a donation back towards my charity. And it's really key for me to get that across today. I'm not a business. I'm not interested in making money or branding. All I want to do is to stop this happening to any other families and to develop my tool further and ensure that it is applicable and compatible with mobile devices and tablet devices, as an example. I need funding to do that. And so I ask businesses who are turning over millions, if not billions of pounds, to donate back towards my charity if they deploy my tool for their staff. My objectives, of course, first and foremost, it's to reduce the number of individuals who self-harm or go on to end their own life. It's also to maximise the number of organisations that are downloading Ripple. It's free for schools, colleges, universities to download, and they can do it en masse. One organisation recently, university, downloaded the tool on over 12,500 of their computers, and it took them 20 minutes. I also have a tech team in place that are able to support anybody who isn't sure of how to download it and how to deploy it en masse. We're ready to help. My big objectives, particularly for next year, is to expand Ripple to be compatible with those mobile and tablet devices. At the moment, Ripple is only compatible on laptops and desktop computers. I'm very aware that particularly the younger audience are fixated on mobiles and tablets, and I need to be on there. I'm also looking next year to expand Ripple globally. I'm starting with the English-speaking countries such as Australia, New Zealand, the US, and Ireland, and then we'll be working towards translating country-specific versions of the tool which feature in-country specific mental health support options that country can provide. I'm also working to hold tech giants and social media organisations to account. I've worked with these organisations for many years in my day job in cybersecurity, and I've now approached this beast really from a different angle, from what they're doing from a mental health perspective. And whilst they're doing some work, in my opinion, they could do a lot more. And they can do a lot more in terms of moderating the content and being more timely in removing some harmful material that is featured on some of their platforms. My mission is also to reduce the stigma surrounding the topic, not only of mental health, but particularly of suicide. Since losing my brother last year, I've had friends that I've grown up with, known for many, many years, that no longer talk to me. And that's because they don't know how to talk to me anymore. They don't know what to say. They're awkward around the topic. They don't want to talk about suicide. And that needs to change. We need to try to normalise this as a topic. And nobody really understands the pain of losing somebody to suicide unless they've actually experienced it. And so I'm trying to reduce the stigma by talking about it, being open around the impact that suicide can have on a family. This is my team. The fact here is that Ripple simply wouldn't exist without these people. We are led by Josh, who is absolutely the reason and inspiration behind this idea and the whole concept. Over 75% of the people that you can see on this screen have also lost somebody to suicide, either their mum, dad, brother, sister, auntie or uncle. They're all part of my club that no one wants to be in. And they've all come forward off their own back and volunteered their time alongside very busy full-time day jobs to help make Ripple what it is today. And the tool wouldn't exist without these people. So I owe them everything. These are some of the charities that fully back Ripple and support Ripple. The biggies on here include the likes of Mind, Papyrus, Shout, and the Hub of Hope, as well as Grassroots. From a business perspective, these are the organisations who have engaged with me or have already rolled out Ripple across their networks and businesses. I wanted to particularly give mention to two of these organisations. The first one is Network Rail, who are looking to roll out Ripple across all of the trains and stations where they have Wi-Fi. That would mean that if any of their passengers, either on the train or at a station, who are surfing the web on the Wi-Fi and were to search for something relating to the topic of self-harm or suicide, that my tool would intercept them and they would instead be provided with that message of hope and a selection of different mental health resources. Similarly, I'm also having conversations with the Ministry of Justice, who are looking to roll out Ripple across all of their Cat D and Cat C prison populations, not just for the inmates, but also for the staff. From an educational standpoint, this is growing on a day-to-day basis. These are all of the organisations that have either engaged with me or have already rolled out Ripple across all of their machines within their organisation. A couple more to come very soon will be the University of Leicester, the University of Wolverhampton and the University of Sheffield, who are all working to deploy the tool as soon as possible. From a media perspective, I've been lucky enough to be invited along to many national media outlets, including BBC, Sky News, Channel 5 and so on. If you are interested and you would like to learn more about my story and how Ripple has come about, then all of my interviews are available on my website, which is ripplesuicideprevention.com. So what next for Ripple? At the moment, the tool is available to download now on Google Chrome and Microsoft Edge, the two biggest browsers. By the end of this year, we're also going to be deploying Ripple on the browsers Safari, Firefox and Opera. Next year, our focus is absolutely to make sure that we are trying to get Ripple onto mobile and tablet devices, and it's also to create more of a global presence. We're getting lots and lots of attention globally, where countries are looking to roll something like this out as soon as possible, particularly Japan. I'm on all of social media accounts. Please do follow me and support me, and anything you can do to promote Ripple, particularly within the educational sector, would be hugely appreciated. Before I pause for any questions, I'm just going to provide you now with a short demo on how Ripple works. So bear with me. Okay. Hopefully you guys can all see Google. So as an example, I'm just going to type in here the word suicide. I've got over 35,000 words, phrases and questions all relating to this topic that are built in, so that if any of them are searched for, then the tool intercepts them. So if I type in suicide, and you can see here that the tool comes up immediately. You've got a short breathing exercise, which has been statistically proven to help that person reset what they're thinking. And then you've got the message of Ripple. You've got a call to action at the top with the emergency services on 999. Lots of people say to me, well, Alice, why have you included that on there? Everybody knows 999. But not everybody understands that if you're searching for ways and means to end your own life, that's an emergency, and that absolutely warrants a call to them. You've then got the message of hope and two tabs: talk to someone now and find continued support. The talk to someone now tab has a range of different resources available for that person to utilise now, immediately. All of them are free and all of them are 24 hours a day. Between the hours of 5 p.m. and midnight, another option appears at the bottom, which is the Calm web chat facility. I've programmed it so that it only appears during its opening hours. The second tab, Find Continued Support, contains a range of resources designed to assist anybody with their mental health on a more day-to-day, ongoing basis. You've got the Hub of Hope, which when you pop in your postcode will come up with the local mental health resources that are available within your vicinity. I've coded it so that there's a QR code in there for people who would like to download the Hub of Hope as an app. You've got Grassroots, which is an app developed by a Brighton-based charity called Stay Alive, and it contains lots of resources on there to help anybody to stay safe from suicide if they're having those kinds of thoughts. And again, there's a QR code in there to provide people with an app should they want to download it. You've then got a check-in tool called 1 Million Lives by a company called Jacobs. You answer questions about how you're feeling, and at the end it provides you with practical tips and encouragement really to take action to improve your mental health. And finally, you've got Click, which is an anonymous forum that is moderated 24 hours a day by mental health professionals. It provides individuals with the opportunity to connect with others who perhaps are also struggling with their mental health. My brother was on many forums. Some of them were around mental health, some of them were around suicide. As of Monday, I've been on about 57 of these forums and banned from about 42 of them. And that's because I've been labelled a pro-lifer for trying to get people the support that they need when they're writing unhelpful comments, encouraging others to take their own life. More needs to be done in this field, and I'm hoping that with some guidance that I can provide from my experience, from a lived experience perspective, but also from an online and IT perspective, that I can help guide the government into doing more, particularly with the online harms bill, around those kinds of websites. every single aspect and component of this tool has a reason and is based on evidence. From the rounded edges to the colours, to the wording, to the options, every single aspect of this is based on evidence and research from professionals in the field. So I'm going to stop sharing that now and pause for any questions that anybody might have. Thank you very much indeed for listening to me.
Thank you, Alice. And there have been so many comments coming through in the chat, which hopefully you can catch up with now, to really thank you for your presentation. And I think, I don't know if others are the same as me, but sometimes there are some presentations that really do stay with you. And I really think this is one that will certainly stay with me, and I imagine many others on the call, just the understandable passion that you have for this and the work really that you're doing in Josh's legacy. So I'd like to hand over for others. We've got some hand raised. I can see Jane, if we come to you.
Thank you. I don't think I was the first hand, but I'll carry on. Alice, thanks. You spoke to me about 6 months ago, and it's just amazing the progress that you have made in a very short space of time. It's looking incredible. I'm not a very techie person, so I think you said, but could you confirm that you can install this over a Wi-Fi connection? Is that correct? So that if I'm thinking of schools where children would be using, they might be using school laptops and desktop computers, but they would also be using their own devices, and they might be using that through the school Wi-Fi. Is that a way to currently access like mobile phones and things, even though you can't load the tool yet?
Yeah, for somebody who isn't techie, Jane, that's spot on. So it can be downloaded in two ways, really. The first way is as a browser extension, and you can download that now on your devices very easily. Just go onto my website, I'll put it in the chat, and click on the button that says install. And what I've done is create a short video on exactly how you can actually install it. It literally takes under 60 seconds to do. The second way that it can be installed is, as you've rightly said, through the Wi-Fi network. That means that we're reaching a higher number of people who are searching for this stuff on Wi-Fi. But what it doesn't do is reach anybody who perhaps is searching for this on mobile devices who are on 4G, 3G, 5G. So there's still a gap there. But hopefully it comes across that, you know, I'm working day and night on this, and I'm, as soon as I can possibly get this out into every single which way, I'll be doing it. And it's growing every day, so fingers crossed. But yes, Wi-Fi and browser extension is how you can download it.
Thanks.
Can I hop in? I've got a question for Alice. Hi, Alice. We met a while ago.
Hi, Luke.
From Southampton City Council. Out of curiosity, obviously it's great to see how much this has developed since I spoke to you last. But when you get pop-up when someone searches any of the sort of key trigger terms, is it purely an information pop-up, or does it physically block access to websites as well?
Great question. It's an interceptive tool.
Okay.
I'm not allowed to block.
Yeah.
Unfortunately, as much as I would love to, I'm not allowed to block anything.
Would that be down to the ISP?
Sorry?
Would that be down to an individual's ISP to block any questionable material? Yes,
absolutely. Yeah. It's about people's choice and free will, unfortunately. So although I can't block these websites, what I can do is intercept them before they get there.
Yeah. And
provide people with a different option when they're searching for these materials. Since I've launched the tool on World Suicide Prevention Day on the 10th of September, it's been downloaded over 95,000 times. and I've had 22 individuals approach me to tell me that Ripple intercepting them is the reason that they're still here.
That's highly commendable, Alice, and fantastic news to hear. And I hope it continues on, especially with the education sector, as we know that for some individuals that can be their first experience of living away from home, relationship issues, drug issues, alcohol, and all sorts of things. So I think it's a fantastic area to try and get on board. Thank you.
Thanks, Luke.
Thanks, Luke. We've probably got time for one more question. As always, you can put them in the chat. I don't know if, Alice, you're able to stay on, or we can forward them to you afterwards. But really want to thank you for joining us today, and the amount that you've achieved since last Christmas. I can only imagine where you will get to by next Christmas. So hopefully you can come back and update us, because yes, as everyone said, highly commendable and all in the memory of Josh. So thank you once again for sharing today and all the work you're doing.
Thank you so much for having me and for listening to me, everybody. I've put my details in the chat, so please contact me if you need anything or want any more information. Thanks all.